Getting 8 hours of sleep will not protect you. But what you do the moment your head hits the pillow, the position most adults over 60 have settled into their entire adult lives without questioning, is quietly collapsing your airway dozens of times every hour, sending your blood pressure surging in the dark, and building the exact biochemical conditions for cardiovascular damage. And it is happening tonight, while you think you are safely at rest. The research is very clear on what this does to your heart, your blood vessels, and your stroke risk over time. And it starts with a single change in position. Stay with me until the end, because what I am going to show you, you can start tonight, and your cardiovascular system will begin responding by morning. My name is Dr. Monty Fisher. This channel is built on one principle. Take the published research on how the aging body works and translate it into plain, practical information you can actually use. What the science of sleep medicine makes very clear is this. Most adults over 60 have no idea that their sleep position is a modifiable cardiovascular risk factor. Not because the research is hidden, it is published, it is consistent, and it has been building for decades. The problem is the gap between what the research says and what gets discussed in a standard appointment. That gap is what this video is here to close. Before I show you which position to stop and which one to switch to, you need to understand the mechanism, because without it, what follows will not feel serious enough to act on tonight. Think of sleep as the time your cardiovascular system is supposed to recover. During deep, healthy sleep, your blood pressure drops, typically 10 to 20% below your daytime level. Your heart rate slows. Your stress hormones fall. The cardiovascular system uses this window to repair and reset. This nocturnal blood pressure dip is so important that cardiologists track it as a health marker. But for tens of millions of adults over 60, this is not what is happening. Instead, their sleep is a series of repeated cardiovascular stress events, and neither they nor their doctors are connecting it to their sleep position. Here is what is happening. When you sleep in certain positions, the soft tissue in your throat, the tongue, the soft palate, the walls of the airway, relaxes and collapses inward under gravity. The airway narrows. Sometimes it closes completely. Breathing stops. This is called an apnea event. Your brain senses the oxygen drop within seconds, and it does the only thing it can. It fires the sympathetic nervous system, the same system that produces the fight or flight response. Adrenaline surges, heart rate spikes, blood pressure surges. Your airway is forced back open, and then it happens again. Dozens of times per hour, every hour of every night. This is obstructive sleep apnea. And the vast majority of people who have it do not know. There is no obvious alarm, just a slightly disturbed sleep and a cardiovascular system working hard when it is supposed to be resting. Research published in medical literature has found that obstructive sleep apnea affects approximately 1 in 3 adults over 60, with prevalence rising in some elderly populations to nearly half. Most remain undiagnosed. A systematic review found that obstructive sleep apnea increases the risk of stroke by approximately 60% and the risk of heart failure by approximately 140%, independently of other risk factors like obesity, smoking, and diabetes. A landmark study published in the New England Journal of Medicine confirmed that OSA independently increases the risk of stroke or death from any cause, with a clear dose effect. The more severe the apnea, the higher the risk. Now, the position you sleep in is one of the most powerful triggers of apnea events, and changing it tonight can begin changing that chain of consequences immediately. There is one position most adults over 60 use that is working directly against their cardiovascular system every night. And there is one position that can begin working for it. I am going to walk through both. For each, I will show you exactly what it does inside your body, the cascade of consequences it sets off, and the specific steps to make the switch. The position to stop. Not the one that feels obviously wrong, the one that feels entirely natural. The one that instinctively seems like the most logical resting position. The one many people believe is the healthiest option. Back sleeping. Here is what is actually happening when you sleep flat on your back with your head at pillow level. Why it feels safe and why it is not. Lying on your back feels comfortable. There is no pressure on any one side of the body. The spine often feels supported. People who sleep on their back frequently report waking without the neck and shoulder pain that can come from side sleeping done incorrectly. So the feedback from the body seems positive. But here is what the body cannot feel. What is happening inside the airway? The cascade begins with gravity. When you lie flat on your back, gravity acts directly on the soft tissue of your throat, the base of the tongue, the soft palate, the walls of the pharynx, and pulls them straight backward and downward toward the back of your throat. The airway narrows. In adults over 60, whose airway muscles have naturally lost some tone with age and whose throat tissue has become more lax, this narrowing is more pronounced than in younger adults. Research measuring what is called pharyngeal critical closing pressure, the pressure at which the airway collapses, has found it increases by approximately 2.2 to 2.9 centimeters of water pressure in the supine position compared to the lateral position. In plain terms, your airway is measurably and significantly more collapsible on your back than on your side. What the numbers show. A comprehensive review published in Sleep Medicine Reviews found that up to 60% of obstructive sleep apnea patients have what is called supine predominant OSA. Their apnea events occur at twice the frequency when sleeping on their back compared to their side. And for approximately 20% of OSA patients, airway obstruction occurs exclusively in the supine position. Their breathing is entirely normal when they sleep on their side. This means that for 1 in 5 people with sleep apnea, a positional change alone can eliminate the condition. The cardiovascular cascade from one night of back sleeping. Each apnea event is a cardiovascular stress event. Blood oxygen drops. The sympathetic nervous system fires. Heart rate spikes. Blood pressure surges. This happens repeatedly, 20, 30, 50 times per hour in moderate to severe cases. The consequence that matters most: your blood pressure is supposed to drop during sleep. This nocturnal dip, that essential 10 to 20% reduction, is the window the heart uses to recover. When apnea events are repeatedly triggering sympathetic surges throughout the night, this dip does not happen. The heart does not get its recovery window. Cardiovascular research consistently shows that people whose blood pressure fails to dip adequately during sleep carry significantly higher risk of heart attack, stroke, and cardiovascular death. OSA is one of the most well-documented causes of this non-dipping pattern. The atrial fibrillation and blood clot connection. Obstructive sleep apnea is an independent risk factor for atrial fibrillation, confirmed in publications from the European Respiratory Society and across cardiovascular sleep medicine. In atrial fibrillation, the left atrium does not contract properly. Blood pools. Research shows that approximately 90% of stroke-causing clots in AFib patients originate in the left atrial appendage. Once dislodged, those clots travel to the brain. This is the mechanistic pathway. Back sleeping triggering airway obstruction triggering repeated oxygen drops and sympathetic activation, that activation contributing to arrhythmia, and arrhythmia contributing to the clot formation that makes this conversation a cardiovascular one, not just a sleep one. What about stomach sleeping? Stomach sleeping is the second position to avoid, and for similar respiratory reasons. Lying face down, presses the chest into the mattress, restricts the diaphragm, the primary muscle of breathing, and limits lung expansion, reducing the quality and depth of breathing throughout the night. For adults over 60 with any degree of reduced respiratory reserve, this adds an additional burden. Stomach sleeping also causes the sustained neck rotation and lumbar compression we have covered in previous videos. It is not the primary cardiovascular offender that back sleeping is, but it is not a neutral choice for adults over 60. If you have made it this far, you are not here for a surface-level tip. You want to understand what is actually happening, and you want to act on it. Most viewers find something genuinely useful here and scroll past the subscribe button. And then, the algorithm does not bring them back. If this video is giving you something real, something you are going to change tonight, tap subscribe. 1 second. You will not miss what comes next. The position to switch to tonight. Left side sleeping. And here is exactly what it does for your cardiovascular system, benefit by benefit, with the research behind each one. Benefit 1. The airway stays open. When you lie on your side, the tongue and soft palate cannot fall backward under gravity the way they do when you are lying flat. The airway geometry is fundamentally different. Side sleeping, both left and right, significantly reduces the frequency and severity of obstructive breathing events compared to back sleeping. For the approximately 20% of adults with sleep apnea whose events occur exclusively in the supine position, switching to the side can eliminate the condition without any other intervention. For the broader group whose events are more frequent on their back, side sleeping substantially reduces the cardiovascular load that OSA places on the heart and blood vessels overnight. Benefit 2. The blood pressure can recover. With fewer apnea events, the sympathetic nervous system is not being repeatedly activated through the night. The nocturnal blood pressure dip, that essential 10 to 20% drop, has the conditions it needs to occur. For adults over 60, managing elevated blood pressure or cardiovascular risk, this matters every single night. It is the difference between sleep as cardiovascular recovery and sleep as cardiovascular stress. Benefit 3. The left side and acid reflux. Left side sleeping specifically reduces nighttime acid reflux. The reason is anatomical. Your stomach sits on the left side of your body. When you lie on your left side, the lower esophageal sphincter, the valve between your esophagus and your stomach, sits above the level of gastric contents. Acid cannot travel upward easily. When you lie on your right side or your back, the geometry reverses, and acid has a far easier upward path. Chronic nighttime acid reflux causes repeated microarousals that fragment sleep without the sleeper being fully aware. It contributes to esophageal inflammation over time. Eliminating it through a positional change costs nothing and begins working the first night. Benefit 4. The brain's overnight cleaning system. 2 connected studies illuminate this. In 2013, Lulu Xie and colleagues published research in the journal Science showing that the brain's glymphatic system, its overnight waste clearance pathway, is significantly more active during sleep than during wakefulness. In animal models, sleep was associated with a 60% expansion of the brain's interstitial space, allowing cerebrospinal fluid to circulate more freely and dramatically increase the clearance of metabolic waste products, including amyloid beta, the protein fragment most strongly associated with Alzheimer's disease. 2 years later, in 2015, a team led by Hee-Dok Lee and colleagues, including Lulu Xie and Maiken Nedergaard, published a follow-up study in the Journal of Neuroscience, specifically examining how body position during sleep affects this clearance. Using dynamic contrast MRI and tracer studies in anesthetized rodents, they found that glymphatic transport was most efficient in the lateral position, compared to supine or prone. The researchers themselves cautioned that the finding awaits confirmation in humans, but speculated that the lateral sleeping position may offer similar advantages for clearing waste from the brain. A neurologist at the Marcus Neuroscience Institute reviewing this research noted an important qualification that deserves repeating here. This represents a notable association between sleep position and glymphatic function, not a proven direct cause and effect relationship in humans. More research is ongoing. What the evidence does tell us is that side sleeping does not interfere with this clearance system the way supine sleeping appears to. Benefit 5. Venous return. Left side sleeping avoids placing sustained pressure on the inferior vena cava, the large vein that returns blood from the lower body to the heart. Avoiding this compression supports circulatory efficiency, particularly in those with any degree of venous insufficiency or cardiovascular compromise. While this benefit is most clinically significant in pregnancy, it remains a relevant consideration for adults over 60 managing cardiovascular health. The important qualification on left versus right side. The primary recommendation is side sleeping. The left side has specific advantages for acid reflux and venous return. However, for adults who have already been diagnosed with heart failure or who experience palpitations or arrhythmia, particularly atrial fibrillation, some cardiologists note that lying on the left may increase the awareness of cardiac sensations because the heart sits closer to the chest wall in that position. If you have a diagnosed cardiac condition, discuss sleep position with your cardiologist before making changes. Right side sleeping is also a valid and beneficial alternative to back sleeping. The airway protection and glymphatic benefits of lateral position apply to both sides. Making the switch from back to side sleeping requires addressing comfort. Most adults return to the back during the night because the side position becomes uncomfortable without proper support. These 3 steps solve that. Step 1. A pillow between your knees. When sleeping on your side, place a pillow between your knees. This keeps the hips level, prevents the upper leg from pulling the pelvis downward and rotating the lower back, and makes the side position comfortable enough to sustain through the night. Step 2. A firm pillow or rolled blanket behind your back. Placing a firm pillow behind your back acts as a barrier that prevents rolling into the supine position during sleep. A body-length pillow works especially well. This is one of the most effective low-cost tools for positional sleep therapy and is widely used in clinical practice for positional OSA management. Step 3. If you cannot maintain side sleeping, consider head-of-bed elevation. For adults who cannot sleep on their side due to shoulder pain, hip discomfort, or other conditions, elevating the head of the bed reduces the severity of airway collapse in the supine position. This is a clinically accepted adjunct in positional sleep apnea management. If this applies to you, discuss the degree of elevation appropriate for your situation with your doctor. Let me bring this all together. The position to stop. Back sleeping. When you lie flat on your back, gravity collapses the soft tissue of your airway. In up to 60% of adults with sleep apnea, back sleeping doubles the frequency of apnea events. For 1 in 5, events occur exclusively in this position. Each event fires the sympathetic nervous system, suppresses the nocturnal blood pressure dip, and contributes to the cardiovascular risk cascade: hypertension, arrhythmia, atrial fibrillation, stroke, that adults over 60 are already managing. The position to switch to: left side sleeping. It keeps the airway open. It gives your blood pressure its nightly recovery window. It eliminates nighttime acid reflux in most people. It supports the brain's overnight glymphatic waste clearance. It avoids compressing the inferior vena cava. And it begins working the first night. That is the cardiovascular sleep switch, 4 steps to make it happen. 1. Stop sleeping on your back. If you wake up on your back tonight, roll to your left side. No other step is required to begin. 2. Place a pillow between your knees. This makes the side position comfortable and sustainable. 3. Place a firm pillow or rolled blanket behind your back. This prevents you from returning to the supine position during sleep. 4. If you have any of the following: blood pressure that is difficult to control, snoring, morning headaches despite full sleep, or daytime fatigue, ask your doctor for an obstructive sleep apnea evaluation. At-home sleep testing is now widely available and simple to arrange. Tell me in the comments, which position have you been sleeping in? And are you making the switch tonight? I read every comment. And if you know someone over 60 who snores, wakes up tired, or has blood pressure that is difficult to manage, share this with them. Sleep position is one of the most under-discussed cardiovascular tools available. That share might be the most useful one they receive this year. Everything in this video is general educational information based on published research in sleep medicine, cardiovascular medicine, and respiratory physiology. It is not personal medical advice and is not a substitute for clinical evaluation. If you have a diagnosed heart condition, arrhythmia, or breathing disorder, please discuss sleep position with your doctor or cardiologist before making changes. If you experience symptoms consistent with sleep apnea, witnessed gasping during sleep, severe snoring, morning headaches, or unrefreshing sleep, please seek a formal evaluation. This video is a starting point for that conversation, not a replacement for it.